Today, we're diving into a really fascinating condition that basically hijacks your body's control system and cranks the engine all the way up into overdrive. This is the story of hyperthyroidism. So just imagine for a second, what if the engine that runs your entire body, the one that controls your energy, your mood, even your temperature, was suddenly stuck on full throttle with absolutely no off switch? Well, that's exactly what we're going to unpack today. Okay, so at the very heart of all this is a piney, butterfly-shaped gland right here in your neck called the thyroid. Think of its main job as controlling the gas pedal for your body's metabolism. It releases hormones that tell every single cell how fast to burn energy. When it's all working just right, it's this perfectly tuned system. But with hyperthyroidism, that delicate balance gets completely thrown out the window. So when this engine is just constantly redlining, the effects on the body are, well, they're intense. They're overwhelming. Let's take a look at what that actually feels like. First off, your heart. It's just pounding away, like you've just sprinted up a huge flight of stairs, except you could be just sitting on the couch. This is called tachycardia, and it's a super rapid heartbeat that puts a really dangerous strain on your whole cardiovascular system. And then you've got this really bizarre paradox. You are starving all the time, eating way more than you normally would, but the number on the scale keeps going down. Your metabolism is just running so incredibly hot that it's burning through calories faster than you can even get them in. And, the impact isn't just physical. Your mind gets swept up in the storm, too. We're talking about a deep, constant feeling of anxiety, of nervousness, of just being irritable. You feel totally on edge all the time, like you've just chugged 10 cups of coffee and haven't slept in days. This quote from a physician, wow, it really puts the severity of this into perspective. They observed that a patient with severe hyperthyroidism often just isn't in control of their own reactions. And this isn't about willpower or anything like that. It's a purely physiological response to this flood of hormones. It's just a powerful reminder of how profound this condition can be. So what's actually causing this massive system failure? Well, surprisingly, in most cases, the thyroid gland itself isn't really the villain here. The real culprit is more like a case of mistaken identity. Get this. In a whopping 60 to 80% of cases, the cause is an autoimmune condition called Graves' disease. This is where your body's own immune system, the thing that's supposed to protect you, gets confused and actually starts attacking your own body. Okay, so here's how that works. Normally, a hormone called TSH acts kind of like a key, gently telling the thyroid when it's time to make hormones. But in Graves' disease, the immune system starts churning out these rogue antibodies that are like counterfeit keys. They fit the exact same lock, but instead of a gentle signal, they jam the ignition on, forcing the thyroid to pump out hormones nonstop. The whole system is completely hijacked. Now, this autoimmune attack doesn't always just stop at the thyroid. It can also go after the muscles and fatty tissues behind your eyes, and that causes a really distinct and often distressing condition that we call Graves' orbitopathy, or thyroid eye disease. The most common sign you'll see is eyelid retraction, which creates this kind of wide-eyed staring look. That can also come along with bulging eyes, that's called proptosis, redness, and even double vision. And it's really important to remember, these eye symptoms are a specific hallmark of Graves' disease, not just a general symptom of all types of hyperthyroidism. So with such a wide range of symptoms, how do doctors actually figure out the exact cause? Let's walk through the diagnostic process. Thankfully, the process for figuring this out is pretty systematic. It usually starts with a physical exam and just talking through the symptoms. But then, a simple blood test really tells the story. Doctors look for low levels of that pituitary signal, TSH, and high levels of the active thyroid hormones, T3 and T4. That combination right there is what confirms the diagnosis. But to figure out the why, they often use a radioisotope scan. This scan basically shows how active the thyroid is. So in Graves' disease, the whole gland is in overdrive, so it just lights up like a Christmas tree on the scan. But if it's something like thyroiditis, which is just inflammation, the gland is only leaking out stored hormones, so it shows really low activity. This scan is an absolutely crucial tool for getting the diagnosis right. All right, so once there's a clear diagnosis, the focus immediately shifts to getting that runaway engine back under control. And doctors have some really effective tools for restoring that balance. You can kind of think of it like a mechanic's toolkit. Option 1 is medication, like a drug called carbimazole, which blocks the thyroid from making new hormones. It's like hitting the brakes. The second option is radioactive iodine. The patient takes a capsule, the thyroid soaks it up, and the radiation inside safely disables the overactive cells. It's like decommissioning the faulty parts of the engine. And finally, there's surgery to remove the gland entirely, the most direct approach, basically taking the faulty engine out for good. Now, picking the right treatment really depends on the individual. For instance, we know that smoking can make Graves' eye disease worse, so quitting is absolutely crucial. For patients who are pregnant, doctors have to be extra cautious and will often use a specific drug that's safer for the baby during the first trimester. Radioactive iodine, on the other hand, is a definite no-go during pregnancy because of the risk to the fetus. So after the diagnosis and treatment, what comes next? Well, for many people, it's about finding and establishing a new, stable normal. And this is really the key takeaway here. While the symptoms of hyperthyroidism can be genuinely alarming, the condition is highly manageable once you get the right diagnosis and treatment plan. There is a very clear path back to regaining control. So, at the end of the day, whether it's through medicine that slows the engine down, or a treatment like radioactive iodine or surgery that basically gives the body a new, predictable engine, one that runs on a simple daily hormone replacement pill, the goal is always the same: restore that balance and give the patient their life back. The story of the thyroid is just a powerful reminder of how unbelievably complex our bodies are. It shows us how one little gland can impact everything, from our heart rate to our state of mind. And this whole intricate dance of hormones and immune signals kind of makes you wonder, doesn't it? What does it teach us about the incredible, delicate balance that keeps us all running smoothly every single day?